Ever hear a whisper about something odd going around? Imagine this baffling illness hitting dogs, making them weaker and weaker, almost like their inner power source is just fading.
It's a really concerning picture.
It is. Okay, let's try and unpack this mystery because today on the deep dive, we're diving into, well, the fascinating and maybe a bit spooky topic of botulism in dogs.
Specifically focusing on one type, right?
Exactly. We're looking at how this particular troublemaker, the Clostridium botulinum neurotoxin serotype C, causes all the problems.
Okay.
We've got some, pretty in-depth medical information here that spells out what's happening.
Good stuff to dig into.
Right. So our mission for this deep dive, let's try to get past the jargon and really understand canine botulism, what it actually is, how it shows up in dogs, and, well, why it's something worth understanding.
That's good. And what's really fascinating right off the bat is that botulism isn't like your typical infection where, the body's fighting off live bacteria.
Oh, how so?
It's a paralytic illness. And it's caused by a preformed neurotoxin.
Preformed, meaning?
Meaning it's already created before it even gets into the dog's system. Think of it like a tiny, incredibly potent chemical weapon that's just waiting.
Wow. Okay, so this ready-made weapon, it has a source then. Who's the culprit making it?
Absolutely. The source is a bacterium called Clostridium botulinum.
Okay.
It's what scientists call gram-positive. That's just a classification. And crucially, it's anaerobic.
Anaerobic, meaning no oxygen.
Exactly. It thrives where there's no oxygen. So you often find it in places like uncooked food, decaying animal carcasses we call carrion.
Right, carrion.
And even in things like silage, that fermented animal feed, if it hasn't been stored properly.
So it could be lurking in some pretty common spots a dog might investigate. And you mentioned serotype C is the main one for dogs.
That's right. Clostridium botulinum can make several types of these neurotoxins, but yeah, serotype C is by far the most common one linked to botulism in dogs.
Okay, so the bacteria's out there, potentially in stuff dogs might eat. But how does this neurotoxin actually cause that weakness, that paralysis we mentioned? What's it doing inside the body?
Okay, this is where it gets really interesting mechanistically. The neurotoxin specifically targets the neuromuscular junction.
Neuromuscular junction, that's the connection point.
Exactly. The critical point where nerve cells talk directly to muscle cells. Its main job, its destructive job, is to interfere with the release of a chemical messenger. Acetylcholine.
Acetylcholine, I know that
Yeah.
one. That's the signal that tells muscles to contract, right? To move.
Precisely. So if this neurotoxin jumps in and blocks acetylcholine release, well, that crucial signal just doesn't get through.
And the muscle.
The muscle can't contract properly. This leads to what we call diffuse lower motor neuron signs.
Okay, break that down.
That basically means widespread weakness and paralysis. It affects muscles all over the body because that nerve-muscle communication is failing everywhere.
So the takeaway is no acetylcholine signal, no muscle movement. It's a direct block.
It's a direct chain reaction, yeah.
Diffuse lower motor neuron signs. Okay, it's technical, but it really paints that picture of a body-wide shutdown of muscle control. Now, we're focusing on dogs, obviously, but are other animals at risk from this type C?
Well, natural infections, they're primarily seen in dogs. That's where we see most cases.
Okay.
However, there have been experimental studies showing cats can be affected. And interestingly, there's actually been one documented natural case, just one report of Clostridium botulinum type C toxicosis in a cat.
Huh. So mostly dogs, but not exclusively dogs.
Right. Dogs are definitely the main concern here.
Got it. Okay, dogs are the primary target. Now, if a dog does ingest this toxin, how quickly might we start seeing those signs, that weakness?
The time frame can vary quite a bit, actually. It could be as quick as a few hours.
At fast.
Yeah. Or it could take as long as, say, 6 days after they encounter the toxin.
Wow, big range.
It is. And historically, one of the key early clues, especially in kennel situations, was seeing several dogs in the same place suddenly develop this acute progressive weakness, almost simultaneously.
Like a mini outbreak, you said earlier.
Exactly. Affecting multiple animals in the same environment was a big red flag.
Okay. And where on the dog's body does this weakness usually show up first? Is there a pattern?
There usually is. It typically starts in the hind limbs.
Back legs.
Right. Owners might first notice their dog seems reluctant to walk, maybe a bit wobbly back there, or just generally weaker in the hind end.
Okay.
From there, it's often described as an ascending paralysis.
Ascending, meaning it moves up the body.
Exactly. It gradually progresses upwards. So hind limbs first, then it affects the trunk, then the front limbs, the neck muscles,
Oh, wow.
and even the muscles controlled by the cranial nerves.
Yeah.
Those are the ones controlling, facial expression, swallowing, that sort of thing.
So it really is moving from the bottom up, potentially causing massive problems with movement everywhere.
That's it. And in severe cases, this can escalate pretty quickly to tetraparesis, that's weakness in all four limbs, or even tetraplegia.
Complete paralysis of all four limbs.
Yeah, tetraplegia.
That sounds incredibly serious, just awful for the dog and the owner. What might a vet notice just during a standard physical checkup? Any clues there?
Well, the dog's heart rate might be a bit off. It could be faster than normal.
Tachycardia.
Right. Or, surprisingly, sometimes it can even be slower. Bradycardia.
Ah, either way.
Yeah. And in really severe cases, the vet might notice what's called diaphragmatic respiration.
Meaning they're breathing mostly with their diaphragm.
Exactly. It suggests significant weakness in the other respiratory muscles, the intercostals. A worrying sign.
Definitely. And when the vet does a more detailed neurological exam, what specific signs might really point towards botulism?
Well, one really interesting and important clue is that the dog's mental status, their alertness, typically stays normal.
Really? Even if they're paralyzed?
Yeah. They might be physically unable to move much, but they're usually still bright and aware of their surroundings. That helps distinguish it from some other things.
Okay, that is a key difference. What about cranial nerves?
Examining those, the vet might find sluggish pupillary light reflexes.
So pupils don't react to light quickly?
Right. They might also see diminished palpebral reflexes. That's the blink response when you gently touch near the eye.
Okay.
Other possibilities include decreased jaw tone, a weaker gag reflex, maybe excessive drooling, salivation, and even a change in their bark or whine dysphonia.
So their mind is okay, but the nerve signals to the body, even the face and throat, are getting disrupted.
That's a good way to put it. The signals are scrambled or blocked.
What about their actual movement, like their gait and their reflexes lower down?
Well, initially you might see a stiff, short, strided walk.
Yeah.
Importantly, usually without ataxia, that kind of drunken stumbling you see in other conditions.
Okay, so stiff, not wobbly.
Right. But this often progresses very quickly, usually within 12 to 24 hours, to the dog being unable to stand, becoming recumbent.
Lying down.
Yeah. And when the vet tests spinal reflexes like the knee jerk, they'll likely be decreased or maybe even completely absent.
Weak or no reflexes.
Correct.
Yeah.
And this usually comes with a significant loss of muscle tone. We call that atonia. And if the paralysis goes on for a while, you can start to see muscle wasting or atrophy.
Makes sense. And it sounds like botulism can hit more than just the muscles we consciously control. You mentioned autonomic signs. What falls under that?
Yeah, the autonomic nervous system, the one controlling all the involuntary stuff, can definitely be affected too.
Like what?
You might see mydriasis, that's really dilated pupils that don't respond much to light. Also decreased tear production, leading to dry eyes.
Keratoconjunctivitis, Sika, KCS.
Exactly. Dry eye. Also, the gut can slow down or stop moving. That's called ileus. And urinary problems are common too.
Like incontinence. Or the opposite.
Could be either, or both, in a way. Difficulty urinating, so urine retention, or sometimes they might dribble frequently, just passing small amounts.
Okay. And one thing you typically don't see.
Right. Importantly, you usually don't see hyperesthesia. The dog doesn't become overly sensitive to touch or seem to be in pain from the condition itself.
That's another useful distinction. So it's a very specific, though complex, set of signs. But as we kind of hinted, some of these signs, weakness, paralysis, could look like other things, couldn't they?
Absolutely. That's a critical point in diagnosis. Differential diagnosis is key here.
What are some of the main mimics, the other possibilities a vet needs to rule out?
Okay, so several other conditions can present quite similarly. There's acute canine polyradiculoneuritis, often called coonhound paralysis.
Heard of that one?
Myasthenia gravis is another big one. Tick bite paralysis, definitely. Even certain toxicities like coral snake venom, the dumb form of rabies, which presents with paralysis, not aggression.
Yeah.
And even something called lacillacid toxicosis, which can happen if dogs accidentally get into certain types of livestock feed.
So, yeah, it's clearly not always obvious. Vets really have to play detective, ruling things out carefully.
Precisely. You have to consider all these possibilities before landing on botulism.
It sounds like a real process of elimination. So, given that, how do vets definitively confirm it's botulism? You mentioned routine blood work probably isn't the answer.
You're exactly right. Your standard tests, CBC, biochemistry profile, urinalysis, they're usually completely normal in dogs with botulism. doesn't tell you much.
So what does?
The definitive diagnosis really hangs on detecting the botulinum toxin itself.
Finding the actual poison.
Yeah. You could test various samples, blood serum, feces, any vomitus, maybe even leftover food the dog ate.
How do they test for it?
The traditional gold standard was a neutralization test using lab mice. But now there are also in vitro lab tests that look for the toxin's antigens directly. And finding antibodies against the type C neurotoxin in the dog's blood can also be strong supporting evidence. It shows the immune system has seen and reacted to the toxin.
Right, so finding the toxin or the body's reaction to it. What about imaging like X-rays? Do they play a role?
Chest x-rays or thoracic radiographs can be useful, yeah. Not for diagnosing the botulism itself, but for identifying potential secondary problems.
Ah, consequences of the illness.
Exactly. Like you might see evidence of negasophagus, that enlargement of the esophagus.
Which affects swallowing.
Right, and that can lead to aspiration pneumonia if food or liquid gets into the lungs. X-rays can pick that up.
Makes sense given the muscle weakness, especially around swallowing. Are there other, maybe more specialized tests that help?
Yes, electrodiagnostics can be valuable. Things like electromyography or EMG.
Measuring electrical activity in muscles.
That's it. In muscles affected by the toxin, the EMG might show abnormal spontaneous electrical activity, things called fibrillation potentials and positive sharp waves. Nerve conduction studies can also be done. Sometimes the speed of the nerve signal is normal, but you might see a decrease in the amplitude of the muscle's response when the nerve is stimulated, like a weaker signal getting through.
So these electrical tests can show the neuromuscular junction isn't working right.
Exactly. They add more pieces to the puzzle.
Okay, so combining the clinical picture, ruling out mimics, and using these specific toxin tests or electrodiagnostics helps pin it down. Let's shift gears then. If a dog is diagnosed, what can be done? What are the treatments?
Well, if you suspect the dog ingested the toxin very recently, say, within a few hours of signs starting,
What then?
you might try things to limit absorption. Gastric lavage,
Yeah.
basically washing out the stomach. Or giving cathartics to speed things through the gut.
Like laxatives?
Sort of, yeah. But there's an important caution. Avoid any that contain magnesium.
Okay, no magnesium. Why?
Magnesium can actually worsen neuromuscular blockade, so you don't want to add that into the mix. Enemas might also be used sometimes.
So that's all about getting any remaining toxin out quickly. What about once it's already absorbed and the dog is clearly sick?
Then supportive care becomes absolutely critical. It's really the cornerstone of treatment.
Supportive care, meaning?
For milder cases, this involves things like physical therapy, passive range of motion, maybe some gentle active exercises if possible to keep muscles from getting stiff, frequent turning if they can't move to prevent pressure sores. Good soft bedding is essential.
Makes sense.
And careful bladder management is vital. They might need their bladder manually expressed or maybe a urinary catheter placed.
Because of the urinary retention issues?
Exactly. And if megaesophagus is present, feeding them in an upright, elevated position can help gravity get the food down.
Okay, that covers milder cases. What about the really severe ones, especially if breathing is affected?
Dogs with respiratory compromise need intensive care. Full stop. It is. This means constant monitoring, often including checking arterial blood gases to see how well they're oxygenating, maybe intermittent suctioning of the esophagus to clear secretions and prevent aspiration.
Okay.
Nutritional support is key too, often via a feeding tube nasogastric, or maybe a gastrotomy tube straight into the stomach. And in the most severe cases, they might need mechanical ventilation.
Being put on a ventilator to breathe for them.
Yes. It's a very high level of intervention, but sometimes necessary to get them through the worst of the paralysis.
Wow, okay. Are there specific medications used to directly fight the botulism toxin itself?
There is a type C antitoxin available.
Oh. Does it help?
Its use is a bit controversial, or at least limited. Firstly, there's a risk of anaphylaxis, a severe allergic reaction.
Right.
And secondly, once the toxin has actually bound to those nerve endings, the antitoxin can't really pry it off. It's generally not effective at reversing the paralysis once it's established.
So it might only help if given extremely early, before the toxin binds?
Potentially, yes. But the risks and timing make it tricky. So it's not routinely used in many cases.
What about other meds?
Well, if the dog develops dry eye, KCS, then lubricating ophthalmic ointments are crucial to prevent corneal ulcers.
Protect the eyes.
Exactly. Now, interestingly, oral antibiotics are generally not recommended initially.
Why not? You'd think infection.
Well, the concern is that antibiotics could kill Clostridium bacteria living in the gut, causing them to lyse or break open and potentially release more toxin.
Ah, okay. Unintended consequence.
Right. Or they can just disrupt the normal gut flora. So antibiotics are usually held back unless there's a clear secondary bacterial infection like aspiration pneumonia or UTI that needs treating.
Got it. So the main focus really is that intensive supportive care, helping the body ride it out and heal itself, rather than directly fighting the toxin once it's bound.
That's the essence of it, yes.
Are there any specific drugs that should absolutely be avoided in these dogs because they could make things worse?
Yes, definitely. There's a list of drugs known to potentially interfere with neuromuscular transmission, which you absolutely want to avoid.
Like what?
This includes certain antibiotics like aminoglycosides, gentamicin, amikacin, also procaine, penicillin, tetracyclines, some tranquilizers like phenothiazines, certain antiarrhythmic drugs used for heart conditions, and, as we mentioned, anything containing magnesium.
That's a really critical list for vets and owners to know. Don't accidentally make the paralysis worse.
Exactly. You need to be very careful with concurrent medications.
Okay. So during the recovery period, what kind of ongoing monitoring is needed? What are the main worries?
Monitoring has to be really diligent. The key things to watch for are any signs of respiratory failure. That's the biggest life threat. Also watching closely for aspiration pneumonia.
Okay.
Checking if the neurological signs are improving, staying the same, or, concerningly, getting worse. Looking for signs of urinary tract infection because of the bladder issues, and keeping a close eye on the eyes for any complications like ulcers from dryness.
So it's not just getting past the initial crisis, but managing all these potential downstream problems.
Absolutely. Recovery requires ongoing vigilance.
Now, thinking about prevention, what can we, as dog owners, actually do to reduce the risk of our dogs getting botulism in the first place?
Prevention really is the best medicine here, as they say, and it comes down to some practical things.
Like?
Primarily, prevent your dog from having access to carrion dead animals. That's a major source.
Okay, keep them away from carcasses.
Ensure you're feeding properly cooked food. Avoid feeding spoiled raw meat or letting them scavenge anything questionable. Basically, control their access to potential sources of the bacteria or the preformed toxin.
Simple advice, but sounds like it could make a huge difference.
You really can. Limiting exposure is key.
What about potential long-term problems? If a dog survives the initial illness, are there lingering issues or complications?
Well, the most severe immediate outcome is respiratory failure and potentially death, of course.
Right.
If they survive that, aspiration pneumonia is a major complication we've discussed. Other potential issues include that dry eye, KCS, possibly leading to corneal ulcers if not managed.
Okay.
And then there are the problems associated with being down and unable to move for a prolonged period, prolonged recumbency.
Like what kind of problems?
Things like parts of the lungs collapsing, pulmonary atelectasis, which can lead to infection, cubital ulcers or pressure sores from lying in one position, and urine scalding on the skin if bladder management isn't perfect.
So it really highlights the importance of that intensive nursing care during recovery.
Immensely important. Good nursing care prevents many of these secondary complications.
Generally speaking, then, what can owners expect? What's the usual course of the illness, and what's the prognosis look like for dogs that get treatment?
The signs of botulism usually hit their peak severity pretty quickly, often within about 12 to 24 hours after they first appear.
Okay, so it comes on fast and gets bad fast.
Often, yes. But the good news, relatively speaking, is that the neurological signs tend to disappear in the reverse order that they appeared.
Oh, interesting. So the last things affected are the first things to get better.
Generally, yes. That can be a reassuring sign that recovery is starting. Full recovery, getting back to normal function, typically takes anywhere from 1 to 3 weeks.
1 to 3 weeks, that seems relatively quick, considering the severity.
It is, in biological terms. It relies on the body actually regenerating new nerve terminals and reforming those functional connections at the neuromuscular junction. The body has to repair the damage.
So the nerve endings essentially regrow.
That's the process, yeah, nerve terminal regeneration.
Okay, so wrapping this up then. Botulism in dogs, it's clearly serious, potentially fatal, but it sounds like with prompt recognition and really dedicated supportive care, recovery is definitely possible.
It is. It's a challenging condition, but many dogs do make a full recovery with the right management.
So, to summarize our deep dive, canine botulism is this severe paralytic illness caused by a potent neurotoxin, usually type C. Early diagnosis and intensive supportive care are Absolutely critical for a good outcome.
Couldn't agree more.
And prevention through just being careful about what our dogs eat or have access to, especially carrion and spoiled food. That's really key.
Definitely the first line of defense.
Considering the really diverse ways this one bacterium, Clostridium botulinum, can cause problems, it really makes you wonder, doesn't it? What other, maybe seemingly unrelated health issues out there in animals, maybe even in us, might have these kinds of hidden links back to environmental factors or, things in our food chain?
That's a fascinating question. The interaction between environment, microbes, toxins, and health is incredibly complex. Definitely food for thought.